Hello and welcome. Thank you for joining me today for the Who Cares We Do webinar. All of the participants are muted, but you will be able to type in questions and comments, and I will address the questions as time allows at the end of the presentation. If you prefer, you can also contact me directly by phone or email. My name is Karen Enriquez. I am the SECO Area Agency on Aging Family Caregiver Support Program Care Coordinator for Cochise, Graham, Greenlee, and Santa Cruz counties. During this COVID-19 outbreak, older adults are among the most vulnerable population, so are their family caregivers. More than ever before, the Area Agencies on Aging strives to be visible, provide support, and provide the most accurate information to support older individuals and their caregivers. This webinar will provide an understanding of the caregiver role, the impacts of caregiving, and also show how the SECO Area Agency on Aging can help. One of the biggest challenges of my program is reaching family caregivers because they don't always identify with the role. So what is a caregiver? A caregiver is a wife who takes away her husband's car keys and becomes the permanent household driver, or a son taking his mother grocery shopping because it's too hard for her to go on her own. It's the first time a woman helps to bathe and dress her mother-in-law, or it can be the wife who takes over paying the family bills because her husband forgot again. The term means so many different things to so many different people. Whether it's a husband caring for his disabled wife, a daughter caring for her aging parents, or a friend caring for an elderly neighbor. These individuals often don't consider themselves caregivers. To them, they're just doing what they need to do. In the United States, families are the primary source of support and long-term care for older adults and people with disabilities. Research shows that while older adults want to stay in their homes and communities for as long as possible, many of them have to rely on family or friends to provide the transportation, food, housekeeping, and their personal care needs. Becoming a family caregiver can happen very slowly, over time, with age-related conditions such as mobility, dementias, Alzheimer's, or it can happen very suddenly with no warning at all. A heart attack, a stroke, a car accident, even a simple fall can have a significant and serious impact on a family. But no matter how you begin the caregiver role, it requires change. Every experience is unique, and there are so many variables. There is no such thing as an average caregiver. So when you think about a day in the life of a caregiver, in addition to the everyday responsibilities they may already have, just imagine how many hours are spent cooking, cleaning, providing personal care, doing laundry, or going to the doctor. That's just the start of the list. You quickly realize there is so much more. Caregivers might have young families, they might have children, they might have full-time jobs. They could possibly be trying to do all of this for two separate households. Studies have shown that coordinated support services can reduce caregiver depression, anxiety, and stress, and enable them to provide care longer, all of which avoids or delays the need for the costly institutional care. The first stages of caregiving are the most challenging. This is when you are the least informed about what's needed and expected, and when you feel the most insecure and uncertain. There are so many things to learn. Most caregivers just make it up as they go. And caregiving itself is a series of transitions. So in reality, over time, the needs will increase and so will the duties. Getting a good diagnosis of your loved one's health condition is important. Learning what specific skills are needed to care for someone with that diagnosis is also necessary. Disease or condition-specific information is available online, but getting information and training should be a priority and will help to build confidence. Taking on new responsibilities can make a caregiver see themselves as more of a nurse rather than a family member. The identity change can cause emotional and physical stress. And caregiving is often a 24-hour, 7-day-a-week job. Managing time and responsibilities is difficult at best. Caregivers often give up a portion of their own activities to juggle their growing schedules, and that can result in loneliness and isolation. Family troubles are also very common, especially if you're not getting the help and support you need from the members of your own family. Sometimes you receive too many suggestions or criticisms. Families often do not respect or agree with healthcare and financial decisions. When you add stress to an already difficult situation, resentment can build on all sides. Most people find it very difficult to ask for help. About 50% of caregivers get no outside help at all. We know that identifying with the caregiver role is crucial, but why else would a caregiver say no to help? Well, one reason caregivers don't get the help they need is because taking care of themselves feels like just one more thing they have to do. Think about it. When someone asks if there's anything they can do to help you, most of us usually say, "Oh no, that's okay, we're fine." But when you're a caregiver, it can be even harder. Caregivers come to the terms with the fact that they can't make their loved one completely healthy again. They still want to be their person though. They think no one else can care for them as well as they can. This protective instinct is powerful and it's so hard to overcome. Another reason why they don't trust hired caregivers is stranger danger. You may have heard or watched TV shows or may even personally know someone who has had a poor experience with hired care. Strangers are scary and we just don't trust them. But most important, some people just lead more private lives. Their home is their safe space and family stuff is very personal to them. They're uncomfortable with the idea of opening up their home and sharing information with outsiders. Many families simply will not allow those people in. And then there's the cost. Many families simply can't afford outside care if insurance doesn't cover it. But how lovely would it be if someone would bring an occasional meal or a dessert, or if someone came in to help with housekeeping? It could actually be an opportunity to socialize as well as get things done. And perhaps someone could just come and stay with your loved one so you could take care of some personal errands. Friends and family have great intentions when they offer help, but it's usually the caregiver's reluctance that results in no help at all. So those little things on a regular basis can really mean a lot. Each of us is unique with our own talents and flaws, but without preparation and assistance, caregiving can bring an ever-changing range of emotions, and it's often bittersweet. Things can become overwhelming very quickly, and those overwhelming feelings can result in what we call caregiver burnout. Caregivers want to fix everything. They want to solve every problem, ease every hurt, but the reality is no one can do it all. Sharing your situation with others who have similar experiences can help with learning those coping skills. We all need someone to talk to. SEGO Area Agency on Aging has established a caregiver support group in Sierra Vista. This peer-led group can help reduce the feeling that you're all alone. The care group normally meets every Thursday from 4 to 5 at Thrive in the Canyon Vista Community Hospital in Sierra Vista. However, due to our current social isolation mandates, the group is meeting virtually on Wednesday mornings at 10 o'clock. The meeting notification and the link to attend will be posted on the SEGO Area Agency on Aging Facebook page each week, or you can contact me directly for the attendance link. So the biggest challenge of resiliency is finding the delight in the midst of the difficulties. Compassion drives the caregiver, and love is strong. Whether you are providing care for someone out of love or out of obligation, you are still improving the person's safety and well-being. Believe that your caregiving relationship has meaning, both for you and the person receiving care. Connect with the person in your care by creating a peaceful space to reminisce, share experiences, and be comforted. On this slide, I've shared their perspectives from families that have shown how caregiving for their loved ones has helped them understand, respect, and love more. Once you do identify with being a caregiver, set realistic expectations and ask for help. And please contact your area agency on aging. An important part of America's long-term services and support system for more than 40 years, the AAAs have been operating in communities since the Older Americans Act established them in 1973. There are 622 agencies nationwide. Each area agency on aging shares a clear mission to preserve the independence and dignity of older adults by providing services and supports that enable them to remain living in their homes and communities for as long as possible. So while each agency on aging provides that set core of services under the Older Americans Act, which includes planning and program development, home and community-based services, and caregiver support, they may also offer distinct services tailored to the specific needs of older adults in their communities. They also play a crucial information and referral role, connecting families with resources. The focus of the Area Agency on Aging programs is to provide information, resources, assistance, and referrals through many services. We are advocates for the elderly and the disabled. We understand the complexities of aging. We listen to concerns and provide solutions. So who cares? We do. The SEGO Area Agency on Aging. The SEGO Area Agency on Aging encompasses Cochise, Graham, Greenlee, and Santa Cruz counties. We support a wide range of home and community-based services, information and referral, meals, in-home care, case management, transportation, evidence-based health promotion services and programs, caregiver support, respite, home safety, and much more. Our state health insurance program, Senior Medicare Patrol Coordinator, Ramona McMurtry, provides assistance with Medicare, Medicaid, and prescription assistance programs. She is available for unbiased health benefit counseling and provides educational workshops and webinars. Shy Martin advocates for residents in nursing homes and assisted living communities through the Long-Term Care Ombudsman Program. She is also responsible for the agency's Health, Wellness, and Nutrition Program, delivering innovative, healthy aging programs such as Matter of Balance, Tai Chi, and fall prevention programs. She also oversees congregate meal sites and home-delivered meals. My program, Family Caregiver Support, was created to assist and educate caregivers. The goal of my program is to advocate for families by providing information and resources needed to care for their loved ones and allow the elderly to remain in their homes with their families for as long as they can. I'm also responsible for community outreach and trainings to educate caregivers. When a caregiver requests assistance and services through the Area Agency on Aging, they may be referred to a subcontracted case manager. Case managers work with individuals and their families to find resources with the purpose of keeping recipients in their home for as long as safely possible. This service assists individuals and their families to identify their functional needs and the appropriate services that are available to meet those needs. They also help individuals in gaining access to any service by providing information, by making referrals to other agencies, or by assisting in the application process. If an individual needs any in-home services, case managers are the gatekeepers responsible for determining eligibility and authorizing services. Dependent on their evaluation, the individual needs, and funding, services are authorized. And after arranging for those services, the case manager continues to stay in contact with the client to ensure the services are meeting the client's needs and that the client is satisfied. Family caregivers that are registered clients are eligible to receive respite service. Respite is temporary supervision of the care recipient to provide a break from the caregiving responsibilities for the caregiver. Receiving outside assistance is important for the self-care of a caregiver. The SEGO Area Agency on Aging has partnered with the Southeastern Arizona Community Action Program, normally known as CCAP, to provide adaptive aid and device installations for clients receiving case-managed services. We are able to provide adaptive aids such as grab bars, handrails, and toilet safety rails if deemed eligible by their case manager. Area Agency on Aging has also partnered with Servants at Work, a nonprofit 501c3 that builds wheelchair ramps for persons with disabilities and conditions of aging, providing them with the freedom to remain in their home and reconnect with their community. SAWS is always seeking volunteers to assist them with their efforts. So to volunteer or to apply for a ramp, go online to sawsramps.org. Unfortunately, due to the COVID-19 pandemic mandates, we are deferring these services until they can be delivered safely. The Family Caregiver Reimbursement Program. It is a grant which assists family caregivers with partial reimbursement for home modifications and assistive care technology, which enables their qualified family member to be mobile, safe, and independent to avoid institutional care. Family caregivers can be reimbursed 50% for home modifications and assistive care technology, up to $1,000 for one or more care recipients. The qualified family member must be 18 years or older and require help with one or more activities of daily living. The funding is limited and is distributed as a first-come, first-served. To apply, the family caregiver must call the Caregiver Resource Line at 888-737-7494. The Caregiver Resource Specialist will complete a pre-screening questions with the caregiver. If they pass the pre-screening, the Caregiver Resource Specialist will mail or email a copy of the application, medical needs verification form, and a W-9 to receive a reimbursement check if approved. The family caregiver will need to complete and submit the application and required documents. Once all the documents are submitted to the Caregiver Coalition, they will be reviewed and the family caregiver will be contacted on the next steps within 90 days. The examples of the qualifying expenses for home modification costs and assistive care technology are not limited to the lists that are shown on the screen. If you need additional information or for any other inquiries, please contact the Caregiver Resource Line at 888-737-7494. This grant is being managed by the Arizona Caregiver Coalition. The Seago Area Agency on Aging offers free, thoughtful life conversations, advanced care planning workshops. For information on workshops, you can contact Ronnie Squires at 520-355-5226 or by email shown on the screen, feelwellsleepwell@gmail.com. When it comes to end-of-life care, one conversation can make all the difference. Planning is important, but whether you make plans or not, the decisions will still have to be made. Talk about their finances and healthcare wishes. Complete the legal paperwork like powers of attorney or advance directives, and bring the family and friends together to discuss the care and keep them up to date on the current situation. Due to our current situation with the COVID-19 and the social distancing mandates, the Area Agency on Aging has had to adapt. By utilizing creative and innovative solutions, we are able to continue to provide our services. Many previously scheduled events have been deferred, and future events depend on how the pandemic continues to unfold. But the public's health and safety remain our highest priority. Please remember to rely on trusted resources for information. It is through the actions that we take today and the information that we share that we protect our communities. Connect with us on our Facebook page and our website for the most current events and the most relevant information. Thank you for listening. I will now address any questions. Always feel free to contact me directly at 520-432-2528, extension 221, or by email at kenriquez@seago.org. Please protect your loved ones and yourselves. Be sure not to cut your own hair. And who cares? We do. Thank you so much from the Seago Area Agency on Aging.